and I'm a doctor. So I hope you're watching this from the confinements of your home. And if not, you should probably go home right now. Help us to fight COVID-19. And to do this, you can take simple measures. Practice good hand washing techniques. You can also wear the appropriate protective gear, and then self-isolation. Now, I know that self-isolation sounds like a nuisance, but you know what's worse? Contracting as well as spreading the disease. So help us in fighting this disease. And finally, be responsible. If you're having symptoms, call the hotline and then go for testing. Help us to fight this.
For those who are entrusted to render such a service. The mandate of the Ministry of Health and Social Services is derived from Article 95 of the Namibian Constitution that states that the health of the citizens have the right for a reasonable and fair access to the public of health services and in accordance with applicable laws. These rights are further enshrined in various government policies and legislations on the protections of the health and the welfare of the people in Namibia. What is happening currently in Namibia seems to be extraordinary, but that is actually what the Article 95 is all about. It's entrusting the health of the nation in the hands of the state, in the hands of the Ministry of Health and all other sectors to fight the COVID pandemic. That is what makes Article 95 all about. Healthcare workers render essential services. As you all know, when the head of state announced the state of emergencies, there were sectors that were listed to be priority sectors for them because they are rendering these essential services, and health ministry is one such sector. Now, a magnitude of the pandemic that we are sitting with today cannot adequately attended to without the right skill mix, in terms of the quantity and the quality of the healthcare workers in Namibia. As such, the government of Namibia, and in particular the Ministry of Health and Social Services, is doing all it can to ensure the increase in number of human resources to respond to this growing demand of not only the COVID-19, but all other related health emergencies that we are confined with. Moderator, before I go on to the question that you have asked, I would also like Ms. Isaacs to add something on as part of the introduction.
Okay, Ms. Isaacs.
Thank you. Good morning, Namibia. I just want to add to what Ms. Kativena has alluded, that during this time of COVID-19, the recruitment of health professionals in terms of numbers is guided by the National Response Plan, which was developed, which clearly indicates the required resources. When it comes to the human resources, the plan which was added to the National Resource Emergency Plan is that minimum number of staffing was proposed for all the levels of care. Example, isolation units, ICU, quarantine facilities, etc. So this staffing requirement plan was shared with the regions and the referral hospitals to align the required staffing accordingly. And of course, this is not the fight only for the ministry. The ministry is supported by various OMAs, NGOs, development partners, SEOs, and other individuals in the private sector. They are also contributing in terms of human resources to assist the ministry in combating the spread of COVID-19 in Namibia. Thank you.
Okay, Thank you, Ms. Kashivena and Ms. Isaacs, for the introduction. Before we go deep into the topic of today, can we give the floor quickly to the Honorable Deputy Minister of Health and Social Services, Honorable Dr. Esther Mwinyangwe, to give us a health update.
Good morning, Tutu. Good morning,
Doctor.
good morning, everyone. Of course, we are saying that it has become a culture that at the beginning of our panel discussion, we have to inform and update the nation, and I'm just going to do that. It's a very brief update because for the past 20 days or so, we haven't really seen any changes or new developments. So I'm informing the Namibian nation that we still have the 16 confirmed cases. We don't have new confirmed cases in the past 20 days. We are happy to announce that the total recovery now stands at 7, meaning that we have 7 recovered cases, and the remaining 9 are also reported to be in very stable condition. They are being monitored on a daily basis, and clinically they are doing very well. As from yesterday, we have tested 675, and out of the 675 tests, 660 tested negative, which is also a very good indication. So the remaining are pending results. And so another important thing also to mention is that the contact tracing is ongoing, as I'm reporting every day. And contact tracing means that those people who have been in contact with confirmed cases, we are tracing them on a daily basis. And so far we have traced 118, and there are still 6 active contacts that are being monitored also. And then with regard to the quarantine facilities, we have been having 566 people in quarantine facilities, and 216 already have been, 350 have been discharged, and currently we still have 216 who are in quarantine facilities. They are there to serve their 14 days of observation. So that is it that we have for today. And as you can see, today is a day for the Ministry of Health and Social Services. We have our 2 panelists there who are going to talk about the management of human resources, because in dealing and addressing the COVID-19, it's not only about making sure that you have the infrastructures, the equipment, and so on, but you also need human resources to deal with this whole issue. And as we rightly heard, to deal with a pandemic, you need a holistic continuum of care. And that is why it is so important this morning to listen and to hear about how do we as a ministry deal with human resources, because we need human resources in all 14 political regions of our country. And so for the journalists, I'm sure that you will have the right people now to ask your questions with regard to the deployment of the staff and all the other human resources. I thank you very much.
All right, thank you very much. That was the Honorable Deputy Minister of Health and Social Services, Honorable Dr. Esther Mwinyangwe, who was giving us an update on the health issues related to COVID-19. So today, as we said earlier, we are busy with human resource management issues, and we are discussing the deployment of health professionals on COVID-19. So, Ms. Kashivena, to get back to you, can you just briefly take us through as to how is the ministry handling applications related to health professionals?
Thank you, Tutu, for the question. Maybe before I get to the deployment or related to the COVID, I would like first to state a scenario on a normal situation, how the recruitment is normally taking place. You know that health professionals in Namibia and possibly elsewhere is not in magnitude, in a big numbers like when you find other professionals. So in a normal situation, the ministry would, for entry positions, people apply as soon as they are graduating. And for the senior or advanced positions, we do advertise and people compete.
Promoting positions.
Yeah,
For the health professionals. But for the, and that depends on whether you have the post in the first place, and secondly, whether the funding is available for you to appoint a certain cadre in the available post. But where you find an entry post, let's say for a registered nurse, you have 10 positions, but you have 15 applications. That is where an interview will take place for you to, not to handpick, but for them to market and to have a competitive approach, and you take those with a high scoring. But now that we are dealing with a situation of COVID, people have been asking whether we have advertised the positions. The ministry have been sitting in, and when I'm saying sitting with the applications, it is across all the 14 regions and the referral hospitals with applications, especially for the entry-level positions, being the registered nurses, environmental health officers, pharmacists, and all those that are freshly graduating from schools. So we did not advertise positions because there were already applications available. But what the ministry also did, in line with the plan that was just explained by Ms. Isaacs, the ministry approached the Office of the Prime Minister to approve an additional structure, a temporary additional structure to the existing staff establishment of the ministry, so that when the situation dictates where we are likely to need more health professionals, we have already an approved establishment for which then we will use to recruit the health professionals. So far, the qualified health professionals where we had already applications, those ones we recruited on the establishment of the ministry because we already had vacant positions and the funding has now been made available. Therefore, we have recruited on the establishment, and some, depending on the conditions, are going to be appointed or recruited on the temporary structure. But I need to differentiate the ministry structure and that of the temporary structure. The temporary structure, we requested to make provision people that are not necessarily going to remain in the ministry, but that we are only using during the temporary period of the COVID to have a quick response team. These are people like the students that are now on the lockdown. They are health professionals, but they cannot sit home while we need people at the screening points, at the surveillance teams, at the checkpoints and all this. So we have employed fourth-year medical students, not medical students, registered nurses. We have also employed medical students, graduates, that are waiting to be enrolled on a program of orientation because they cannot start now since the lockdown period. We are preventing a group gathering or mass gatherings. So those are the healthcare workers that we are employing. There are also certain categories like environmental health officers that we have deployed mostly at the checkpoints and the cross-border points for us to ensure adequate assessment and observations being carried out at those points. Similarly, we have also recruited foot soldiers, being the community health workers, because previously we could not employ them, but they has been already trained by the ministry. So this group of people are the ones that we have taken as the first initial employment on the ministry, and then should the situation, we will also embark upon employing other categories that are non-health workers, such as porters, drivers, cleaners, and so forth. But you may also know that during this lockdown, there are certain ministries where they have kind of closed offices. So before the ministry can recruit people from, there are people that are receiving a salary and sitting at home. We are likely first to engage those sectors so that we can make use of a human resource that are already being paid for by government. And should that not be the case, then we can start employing people from outside. But also for you to know that we are not going to place any advert, because during this time where people are really trying to put measures in place, we do not want to sit with a situation where you sit with boxes and boxes of applications. You know very well that the Ministry of Labor has already enrolled over about 80,000 job seekers. So this is the ample time now for the Ministry of Health to rather approach the Ministry of Labor for them to give the adequate number of people depending on the categories that we want, so that we can then get from those that are already listed for job seeking. Maybe I will pause here unless you have a further question.
Okay, Ms. Kashivena, you spoke about recruiting or bringing on board the students who are fourth-year students, for example, who are doing registered nurse or studying to become registered nurses. So what is the contract period that you are recruiting them or having them on board, and how will this affect their studies if, for example, the lockdown will be lifted next week and then they have to go back to school?
All right, thank you, Tutu, for the question. That's why the structure is temporary, and the situation will dictate on the period that we will need these health workers. I forgot to mention also that not only are the students of the registered nurses, but we are also making use of 6-year medical students from UNAM. Now, if the lockdown period already, let's say it's announced that we are no more on a lockdown, those students will automatically go and be released from their duties, and then they can go and start, commence with their studies. One thing is that the more you prolong their studies, the more you deprive the Ministry of Health not to get a product after their training. So even for the other cadres that I have mentioned that will be temporary on the structure, for now the minimum period that we gave them is 3 to 6 months, and then we will assess the situation. So it is really a temporary structure. There is no long-term binding or commitments on this.
Okay. Ms. Isaacs, can you just tell us, this deployment that you are doing now, is it only in Commerce region, or is it for the whole country, or what are exactly the arrangements with regards to the deployment of health professionals?
Okay, thank you. The deployment of health workers is done in consultation with the regions. So mostly the regions will prepare the appointment documents from the applications they have already in the regions, depending on the categories they need, and then that documents will be forwarded to head office for the executive director to approve such appointment. But like the students and student nurses and medical students, they have completed the application to volunteer. The recruitment is done from national level, and then we distribute them in various regions according to the need to assist also in the regions and not only at head office.
Okay, with regards to the volunteers, does that mean that you only have volunteers in Commerce, but the other regions, people cannot volunteer, or are they also welcome to do voluntary services of a of any kind at any regional office or health facility?
Okay, they can appoint, volunteers can be appointed also in the regions, but the appointment is centralized. They have to forward the application forms to national level, and their appointment will be done from here.
Okay. Okay, Ms. Kashivena, there has been recent questions now about the issues related to medical graduates who are complaining that the ministry is taking too long with the placement of interns. And they want to do their internships. They have graduated already from various universities, whether it's locally or internationally. So how far is the ministry with this process of the medical interns starting with their internship, and what are the hiccups?
Okay, thank you, Mr. Moderator. I should state here that the placement of internship depends on the approved by the Health Professions Council for the ministry then to start placing the interns. It also depends on the period they complete their training and the placement, the period that the current second year interns vacate those spaces so that they can create space for the second group to come. Now, for those that are to be enrolled as medical interns now, there has been a group of February and March this year. There is, however, a process first that needs to take place. That is being the process of placing these medical interns into the 5 teaching hospitals. Now, before such a process can takes place, there won't be any recruitment, because after the placement, let's say this, the medical superintendents of the 5 teaching hospitals get together and they have 100 students to place, they allocate 10 students here, how many of the interns according to the hospitals. With that, the ministry makes then a submission to the Health Professions Council so that then a letter of appointment or placement is received from the Health Professions Council. That is actually done for monitoring purposes, that the Health Professions Council also know where is this student undertaking their training. So on the 22nd is when this placement activity took place, and the recruitment process is in progress. Unless maybe Ms. Isaacs would also want to add something.
Okay, Ms. Isaacs, you were talking about the volunteers earlier. Can you tell us, these people who are volunteering and want to perform voluntary services, will it be done on just a voluntary basis, or will they be remunerated or compensated something at the end of the day?
Thank you. The volunteers officially appointed to date will be remunerated according to the various job categories and then the grades of those categories. As mentioned already by Ms. Kachivena, the volunteers we have recruited thus far on the newly temporary approved structure are 560 in various categories, and they have received appointment letters indicating what they will receive as remuneration.
Okay, if you are watching us live from home, we would like to open up the lines. You can call in and ask your questions. The telephone number is 061-400-397. If you are watching us live, you can call us live in the studio and you can ask your question, 061-400-397. Okay, Ms. Isaac, you were talking about the various job categories. Does that mean that if I want to volunteer, and I'm a graduate, I have a diploma in nursing, will that mean that I'll be temporarily appointed as a registered nurse, for example, or enrolled nurse, then I'll be remunerated according to that grade, or how will it work? Can you just give us a practical example maybe?
Okay, thank you. If you are appointed as a volunteer, you have also to meet the requirement of that specific job category you are appointed to. For instance, if we appoint a registered nurse temporary on the approved structure for COVID, such a registered nurse will be remunerated on the minimum salary notch of the permanent registered nurse. So it's basically the same remuneration wise, but the minimum of the registered nurse. Like we have recruited student nurses, they did not yet qualify as registered nurses, so they will be appointed according to their qualification, which is now currently grade 12. That is the highest qualification, so they are appointed according to that grade, which is now grade 12, with somebody with a grade 12 qualification. But if we have, like the public health officers, public health graduates whom we have appointed, they have a 4-year degree. So they are remunerated according to someone having a 4-year degree in the public service.
Okay, you mentioned that they will be placed on a minimum salary notch. So what happens now to those that have working experience? For example, I was a registered nurse, then for some reasons, maybe let's say I went to study medicine and I came back and now I'm volunteering. Will you still place me on the minimum notch or will you recognize my working experience?
Yeah, since it is a temporary appointment, we do not give any recognition for previous experience. It's just on the minimum of the scale of that job category.
Okay, we have a caller on the line, Lucas from Windhoek. Lucas, welcome. Lucas? Hello? Hello, Lucas? Can you hear us? Okay, it seems like we've lost that caller. Ms. Isaacs, I wanted to also ask, this temporary appointment, does it also include benefits or am I just getting a basic salary? Do I get any other allowances or benefits attached to this appointment?
Yeah, there will be benefits, but only the housing allowance and transport allowance.
Okay.
Let me also add that. Can I?
Okay, before that, we have Mesia on the line from Windhoek. Mesia?
Good morning, sir.
Good morning.
I would like to find out, I'm having a question for Ms. Anna. I'd like to ask, do they also, are they also looking for volunteers to assist with employing the people to assist with COVID? So if they are extra office, do they also need people that can assist to do the appointments, the appointment letters and all those?
Sorry,
That's my
Mesia,
question
can
for the
you just
day.
repeat your question?
Yeah, thank you.
Okay, I was trying to ask that, are you looking for volunteers? I think that's what I could get from the question.
The question is not clear. So
The question
she
is a
can-
little
she
bit
can-
not clear, but she's asking if you are looking for volunteers for COVID-19.
Can I get to that?
Okay, Ms. Kashivene?
Yeah, if the ministry have been also receiving people or people who visited the ministry physically, asking whether they can come and volunteer to be a driver, to be just a hand, a helping hand. As I earlier said, we are not going to entertain people just coming to say, I want to come and volunteer. It should be need-driven. And should that be the case, if you are a healthcare worker, amongst the categories that we have mentioned, and you are sitting home, and you are in the age group that are allowed by the public service to be recruited or employed, those are the ones that we will entertain, but they should meet their entry appointment requirements, and they can submit then their applications to the Human Resources Development, only for the healthcare workers. For the others, we are not entertaining them because we will go through the Ministry of Labor.
Sorry, Ms. Kashivena, we have Jessica on the line from Oshivarongo. Jessica,
Hello.
good morning.
Yeah, good morning.
What is your question today?
My question today is I just want to find out what is the role of the health extension workers in this COVID-19 fighting epidemic? Because there are trained health extension workers that are not yet employed. How are they being considered?
Okay, the question from Jessica is that what is the role of health extension workers, the community health workers in COVID-19? But before you respond to that, can we just give the floor to the journalist on the floor for the question?
Republica newspaper. I just have a few questions. Firstly, I would like to know what is the existing staff complement of the Ministry of Health and Social Services? We heard the past week that 1,053 additional employees have already been recruited, that the target is 2,605. I'm seeking clarity, wanting to establish whether I heard you correctly, that it's only 560 people who've been recruited thus far and not 1,053. Then I'd like to know at what cost are these additional appointments made? Then just two questions to the Honourable Deputy Minister of Health and Social Services. I would like to hear from you, Doctor, what does the ministry regard as an isolation facility? Particularly because we have learned of COVID-19 positive patients who were accommodated in a facility where other people are living as well. In fact, where there are restaurants where food is being served too. And lastly, can you say something about the testing kits that we donated to Zimbabwe? Thank you.
All right, thank you. Can we take a caller? There's a caller on the line from Zambezi region.
Good morning, good morning.
Good morning.
How are you, sir?
Fine, how are you? What is your question today?
I just wanted to ask the people are there. In case someone wanted to apply, but he did not apply yet to the Ministry of Health and Social Services, what can that person do? If he just want to apply now, but he's not applying, he doesn't have an application there.
If somebody wants to apply for which job category?
The one that says.
Any.
I'm sorry, I'm not getting the question. Can you please repeat it?
I'm saying, we are hearing about the recruitment which the Minister of Health is busy doing.
Yes.
So he was talking about going to the Ministry of Labour, if there's certain application which you are applied there, and then they'll be looking at those applications. So my question is, if in case I did not apply yet to any ministry, I wanted to apply, what can I do?
Oh, okay.
Yes.
All right. Thank you very much. So, Ms. Kashivena and Ms. Isaacs, we have questions, starting with the ones of volunteering to assist in COVID and the role of health extension workers, as well as the one that he did not apply with the Ministry of Labour and he wants to apply now. What are the procedures, or can he apply? Maybe you can start with those ones, and then Ms. Isaacs can look at the existing staff complement and the costing.
All right, thank you very much for the questions. I would like to start with that of the health extension workers or community health workers, what would be their role? Earlier on, we spoke about the establishment of new health facilities, being the isolation facilities where healthcare workers will be needed, the step-down health facilities where healthcare workers will be needed, as well as at the checkpoints where normally you will see more the police being at these checkpoints, but we also need healthcare workers there. Now what we are doing is we would like to use the qualified healthcare workers in these isolation facilities because they will know how to adequately attend to these clients that we are admitting there. But at the roadblocks, for example, you may not necessarily need a fully fledged trained healthcare worker, but you may need a community health worker just to check on the parameters of the client, the temperature checks, and then they can then refer should that be such a case. So we are trying to fill the gaps that were already there, as well as use the community's health workers to go where possible. We know that we need to still have the distancing, the social distancings that are there. But there are contact tracings that are also happening where you need to go and constantly, for those people that are quarantined, you need to go and do a temperature check, you need to go and conduct a health questionnaires. These are the people that we are also using, as well as the inter-regional, checkpoints that has been created.
Okay.
So now, for the last question from the gentleman of Zambezi, if you did not already apply to the Ministry of Labor, we are not advocating for people now to run to the Ministry of Labor, because that has been already the practice to say, if I'm looking for a job, you already give your name to the Ministry of Labor and they start assisting you in getting employed where vacancies become available. But if you are a healthcare worker, that is where the difference comes in. The ministry will appoint healthcare workers in the approved structures. Should, for example, a region do not get adequate numbers of what they need, then we are likely to start putting adverts. But for entry positions that we are now employing people for, there is no actually a mandatory advertisement according to the public service rules. You just get the applicant. If you have a position, you fill. If, for example, Commerce Region receive applications, but they do not have position, and Oshikoto or any other region need that, that is the role of the national level then to start placing the healthcare workers where there is a need.
Okay, and Ms. Isaacs, can you just attend to the questions regarding the budget, the costing, as well as the existing staff complement?
Okay. As of yesterday, 24 April, we have in total recruited 1,101 staff members. This number includes the volunteers, which is 560. All the 541 are on the staff establishment of the ministry. That is why there is a difference in number. 560 are appointed as volunteers as part of the 2,605 positions created temporary, and the 541 are in the permanent approved structure of the ministry. Where we don't have category like the community health workers, we don't have positions on the ministry's approved staff establishment. That is why we have appointed them temporary in the approved structure for COVID-19. And then the cost implication for the 560 for 3 months will run into 12 million plus.
Okay. Thank you very much. Honorable Deputy Minister, there was a question regarding the isolation facility as well as the testing kits that were donated. Can you please respond to those questions?
All right, thank you very much for the two questions. Maybe I should differentiate between an isolation facility and quarantine facility. A quarantine facility is a facility where we put all the people that we suspect, or people who have been coming from outside Namibia, or someone who have been in contact with a confirmed case. So those who go into a quarantine facility are people who have been at high risk, who have been exposed. Let me rather say who have been exposed. So we put them in a quarantine facility for 14 days. Now, an isolation facility is a facility that we are using when someone has tested positive. So they go into isolation to minimize any contact with any other people that might also be put at risk. That is the difference. So I don't know whether I'm answering that question. Okay, what is your question then?
The question was, there are COVID-19 confirmed cases. who were in an isolation facility, and I'm mindful of the distinction between isolation and quarantine, who were housed in a facility where other people who don't have the virus, who were not at risk, who have not been exposed, were also housed? That's my question.
Okay. I think that matter has been addressed, you know, because even on, is it on Tuesday or Monday newspaper, the ministry, through our minister, responded to that one. There was a miscommunication between the health workers and the owner of the facility, and the matter was explained, and it was, as far as we are concerned, it's a closed chapter. So I'm not sure why we are bringing it up, because it has been addressed.
Okay.
The second question.
The second question, Honorable.
The second question is, what is my stake on the testing kits that were donated to Zimbabwe? That was the question, isn't it? Yeah? Okay. For that one, I would just want to say I have no comment on that one. The thing is, we know that countries are assisting one another. We are also receiving from other countries, and we also, if we are in a position to help a neighboring countries, we are doing that. So that is what I can say.
Okay. Thank you very much, Honorable. We have a caller on the line, Vaino from Rundu. Vaino?
Yes.
Good morning. What is your question this morning?
Yes, good afternoon. My question is special, like the one which they are going to recruit these health workers. And things in the country where these health extension workers, they were trained. Things, let's say it is 1 year ago, they have been spent on the state fund. Up to now, they are at home, doing nothing. I hope this is the time. Why can't they use chance to use them, even though they will require them to recap for the training which they were gaining on 1 year ago? Because they cannot be sent from the public like that without getting a training, and they need extra training again, which will cost another cost for the state again. It's impossible to do that. Let's hear from the Deputy Minister of Health how they think about that case for that health extension which they were trained. They are at the home doing nothing. Thank you.
You are asking if the health extension workers that were trained more than a year ago, that are
Yes.
at home doing nothing, if they cannot be used currently.
Yes.
And you would like the Deputy Minister to respond to that?
Thank you.
Okay. All right. I think I would rather give that to our Deputy Executive Director, Ms. Kashivena, to respond to the question.
Yeah. Thank you for the question, Vaino. Yes, the community health care workers are the ones that are being recruited, and our teams that are at the emergency operation centers are conducting refresher trainings, not only for the community healthcare workers, but even for our healthcare workers in the facilities on the applications of certain SOPs related to COVID-19. As you know, COVID-19 is not just a disease like any other. Other countries are also in the same situation like us, where you need additional human resources. You need to educate them on the do's and the don'ts of the COVID-19. So to reply to him, yes, these are the people that are being used. Okay. In addition, there are also
Ms.
other...
Kashivena,
okay.
We have a caller on the line, Maria from Windhoek. Maria?
Yes, good morning.
Good morning.
I would just like to find out from the panel, apart for the volunteers, so there are social workers from defense, from gender, who are currently deployed at Ministry of Health due to COVID. So I would just like to find out from the panel, are they going to be given any allowance or not? And the second question is that for staff who are currently working full-time at Ministry of Health, I'm sure this time around they are working extra hours. Are they going to claim for overtime or not, or are they going to be given any allowance? So thank you.
Maria, let me see if I got your question well. You are asking if the social workers will be given any allowance and will they be allowed to claim for overtime? Is that right?
Yes, social workers who are currently deployed at Ministry of Health, such as the social workers from gender and the social workers from defense.
Okay, it's social workers from other offices, ministries, and agencies who are deployed at health.
Yes.
All right, thank you. Ms. Isaacs, would you like to respond to that?
Yes, thank you. Staff members within the public service who qualify for overtime remuneration, it means those who are below management cadre qualify for overtime payment. So the ministry is also in the process to get the names and details of everybody who is involved in combating the COVID-19 pandemic, so we can work out the cost implications when it comes to overtime. And what else?
Okay, we have Edmund on the line. Edmund?
Yes, good morning, my brother.
Good morning. What is your question today?
I have the following question. I would like to ask the following question to the Honorable Deputy Minister of Health. In the first place, I just wanted to find out from a layman position whether we are having cure for COVID-19. The reason why I'm asking this is that we understand that there are patients who have been diagnosed with the virus, and so now they are being cleared from the COVID-19. The second question that I would like to ask.
Before the second question, can you just repeat the first question, please? Are you asking if we have a cure for COVID-19?
Indeed, yes.
Okay, all right.
Yes. The reason is because we have. The reason is yes. The second question that I want to find out is whether the ministry have make a follow-up with the patient who have recovered to redo a test. Because this is a virus. From my understanding is that virus remains active. I do not know whether COVID-19 is not a similar virus like HIV and other virus that keeps, active in the human's body.
Okay, you are asking if the ministry is following up on the patients that have active cases and as to whether the cure is not the same as HIV. Is that your question?
That indeed, yes.
Okay, Honorable Deputy Minister, we can give you the floor to respond to those two questions.
Yes.
Thank you, Edmund.
Edmund, thank you very much for your two questions. The first question on the cure. It's a well-known fact at the moment that there is no cure found yet for COVID-19. The only ways of trying to prevent it is what we have been preaching all the time, that people should stay home, they should wash their hands with soap, and that people should also have adhere to social distancing. So those are the measures, some of them, that we are educating the community on how to prevent further spreading of the virus. At the moment, there is no cure for it at all. On the question whether there are follow-ups on people who have been recovering, of course, before people are being discharged, we are making sure that we test them twice to make sure that the test is not showing anything else, but it's just showing that they are negative. So before discharge, they received what we are calling post-counseling for them to prepare them should they experience any symptom or whatever, they should quickly come back to the health facilities. But so far, from all the 7 that have been discharged, we did not, hear any complaints from them. Of course, our case management team is also following up on them, because you need to have aftercare service, that is for sure, to make sure that they are not showing any signs. So those are the answers for your 2 questions. No cure at the moment for COVID-19, and of course, before any person is being discharged, he or she is tested twice, and if the 2 tests are coming back as negative, then we are sure that that person is ready to be discharged, and our case management team have a follow-up to make sure that everything is in order. Thank you.
Okay, thank you very much, Honorable Deputy Minister. Okay, I just want to inform the public that the lines are closed, and we are going to take the last question of the journalist who is on the floor.
Mr. Moderator, thank you for your indulgence. I have a question for Ms. Isaacs, just very briefly. Can you give us a breakdown of the 1,101 in terms of medical practitioners, enrolled nurses, registered nurses, student nurses, medical interns, emergency care, medical graduates, public health officers, pharmacists, pharmacist assistants, social workers, radiographers, environmental health practitioners, community health workers, and other. Just very briefly, please. And just a point for the Minister, the Deputy Minister, in as much as the chapter is closed relating to that isolation facility where COVID-19 positive patients were housed, we don't know whether the other people have been tested and how they're being dealt with. But thank you very much.
All right, thank you very much. Ms. Isaacs?
Thank you. So do you need me to read the numbers in all the categories? The breakdown. Okay. We have 2 administrative officers, 5 cleaners, 416 community health workers, 1 driver, 6 emergency care practitioners, 96 enrolled nurses, 2 environmental health assistants, 59 environmental health practitioners, 55 medical graduates for case management and surveillance teams, 38 medical officers, 23 medical students for infection control teams, 7 pharmacists, 4 pharmacist assistants, 34 public health officers, 1 radiographer, 317 registered nurses, 7 social workers, 26 student nurses, and 2 science and technology officers.
All right, thank you very much. Honorable Deputy Minister, would you like to respond to the last question?
Thank you very much. The last question is very clear. It's about what did we do as a ministry after it came out that the people, the 3 who were put at that specific facility were COVID-19 cases. Of course, we are talking about contact tracing. So in this case, it was easy for us to find out who else were at that facility who might have come into contact with the 3 cases, and they were attended to. That's the answer. So there's no way that we are tracing people in the community and then we will not attend to those who have been in contact with the 3 who were at that specific facility. Thank you.
All right, thank you very much. Ms. Isaacs, together with your concluding remarks, I would like to ask as to, we know the fact that the Ministry of Health and Social Services provides essential services. Now, I just want to also find out as to why is it that most employees of the Ministry of Health are on lockdown. Is this not hindering the service delivery? Together with your concluding remarks, please.
Okay. In conclusion, I would just like to thank the general public and the whole nation of Namibia who are part of the team to fight this COVID-19 pandemic. Even the men on the street, if every one of us will pull together, we will overcome this pandemic. When it comes to the question of why most offices are closed, as you rightly said, yes, the services of the ministry are essential, but currently we have all departments functional. We made arrangements in various directorates for staff to alternate in order to avoid overcrowding in offices. But there are staff, there is no office which is closed. Even though there are skeleton people, the offices are running.
Okay, does that mean that even in the regional offices of the Ministry of Health, the whole ministry is operating countrywide?
Yes, yes, sir.
Okay, thank you very much. And Ms. Kashivena, together with your concluding remarks, can you just tell us also briefly as to whether the Ministry of Health and Social Services and the government at large, they are thinking about a risk allowance to give to the staff members that are at the front line, more especially the health professionals, who are obviously at risk because they are screening the positive and negative cases. Are you giving them any risk allowance or not? And together with your concluding remarks, please.
Thank you very much for the question. I would like to start by saying some time back, the Office of the Prime Minister did some job evaluation and job grading, and it was called a JEC in an abbreviation form. This for all the job categories in the public sector. Now, there were various factors that were considered during this evaluation process, and some of those job factors were the job knowledge required, the skills required, whether the job category require physical body involvement when you are rendering your services, the type of risks that are associated with the job that you are rendering. As such, different gradings were then put together, and by the end of this assessment, each and every job category that were classified as being rendering a risky service to a nation were put together, and their remuneration package were already included in this. So at this moment, we are not considering any risk allowances because it's already factored in the remunerations that are currently being provided. So whether today is COVID, tomorrow or 5 or 10 years to come, there is nothing. A risk allowance is already included in the remuneration of all those that are rendering or classified as risk services that they are providing. This was done to have a consistency in a sustainable way of remunerating the staff that are providing this, so that with every emergency that are coming up, we are not thinking of what remuneration or risk package should be put in place. Now, by way of concluding, I would really like to first appreciate the leadership that we are having in Namibia for availing or for making a conducive environment under which this COVID response is being undertaken. One such undertaking is this platform where we inform the nation of what is happening around us. Secondly, the Office of the President, the Office of the Prime Minister, and all other sectors that are really engaged in the COVID, in the prevention of the further spread of COVID are appreciated, and mostly the healthcare workers, the policemen and women that are out there protecting the nation for moving while there is a limitation in the what we call the lockdown. They are appreciated. So let us stick to the lockdown requirements for us to spread the further, for us to cap the further spread of the coronavirus. Thank you.
Okay, thank you very much. There you have it. That was Ms. Bertha Kashivena, the Deputy Executive Director in the Ministry of Health and Social Services, together with Ms. Anna Isaacs, the Deputy Director for Human Resource Management in the Ministry of Health and Social Services. They were giving us an update on the deployment of staff and responding to other issues related to human resource management. We have come to the end of our session today. If you have any further questions, please send an email to covid.num@mict.gov.na, or you can call the toll-free number 0800-100-100, and that toll-free number is only for issues related to health. And finally, tomorrow, as we embrace the usage of technology, we are going to have an update from all 14 regional governors who are going to be talking to us live from their respective regions and giving us an update. So from me, Tutu Haukena, and the rest of the crew, thank you very much for joining us, and have a blessed day.
Hi, I'm Anna, and I'm a doctor. So I hope you're watching this from the confinements of your home. And if not, you should probably go home right now. Help us to fight COVID-19. And to do this, you can take simple measures. Practice good hand washing techniques. You can also wear the appropriate protective gear, and then self-isolation. Now, I know that self-isolation sounds like a nuisance, but you know what's worse? Contracting as well as spreading the disease. So help us in fighting this disease. And finally, be responsible. If you're having symptoms, call the hotline and then go for testing. Help us to fight this.